9:50 exactly, our final interview for the morning to discuss something pretty important. It is World Arthritis Day 2022. And to join us in unpacking this issue is Dr. Siviwe Mila, medical advisor at Proactive Health Solutions. A very good morning to you. Welcome to the program.
Good morning, Julie, and good morning to your listeners as well.
What is the theme for this year's World Arthritis Day? Because all of these days are themed accordingly. So what would the theme be this year around?
So this year the theme is "It's Your Hands, Take Action." So I think
Ah,
with anyone who would understand what arthritis is, it's like literally if you have a granny or if you have anyone that's
yes.
elderly, they'll be like, I can't even move my hands. And the biggest one of the characteristics is that someone will say the pain comes mainly at night, the pain like so much aina, and then during the day it gets better. Or like
Mm.
very early in the morning, around 5 a.m., the pain is so much that I can't even bear it. So this year, the theme for Arthritis Day is that it's your hands, take action. I think also it's going in the fact that certain things with arthritis are controllable in terms of, we call them risk factors that are controllable, and some of them are not controllable. And I think also, you know,
And that,
um,
of course, that is out of your hands, is it not? The
correct.
uncontrollables.
The uncontrollable are definitely out of your hands, definitely.
Okay. When you talk about, older people talking about, complaining about the pain in their hands and the fingers, I can identify with that in a very big way because my mom-in-law, dear mom-in-law, may she rest in peace, she's passed away 2 years ago. But she suffered from arthritis and she used to continuously complain about her hands going stiff or her fingers going stiff in the mornings or certain time of the day.
Yeah.
And what her daughter used to say to her, my sister-in-law, who is a doctor as well, a medical doctor, she used to say, try and just keep your fingers flexible
Okay.
all the time, use that stress ball. But what she did was she resorted to knitting. She used to knit all the
Oh,
time
wow.
and said that that helped her
Yeah.
greatly. So that's just from my personal experience.
Yeah.
What else can you share with us regarding World Arthritis Day? And you started out by saying older people, but
Yeah.
I'm more than certain that yes, it is an older person's disease because you become osteoporotic or whatever else it is over the years. But do we
Yes.
see arthritis in younger children? And if we do, why?
Yeah. So, just maybe a bit of background, Julie, that some for your listeners, that arthritis is literally like you've got a cogwheel so that things can be able to move nicely. That's what happens with our joints. We talk about wrist joints, elbow joints, shoulder joints. So literally you've got the bone and also you've got a lining, which we call as a cartilage on top, so that these could be able to move against each other. So what happens in arthritic conditions is that you literally have a disruption in this movement, nice movement. So it could either be that the lining itself has gone, which is what mainly happens in osteoarthritis, and therefore the bones start shifting against each other, and that's where the
Oh,
pain is. So then, like, that's why they will not be able to move. So it's much comfortable for them to stay in one position, because the moment any movement, it's like literally bone scrubbing, like almost like when someone's grinding their teeth. So it's bone upon bone. And another form of arthritis that's quite common is what we call rheumatoid arthritis, where you've got an inflammation between these two joints, where like now it's all swollen up. You want to move, but there's something that is in here that's making it all swollen up and quite painful. And with kids, you get what we call juvenile arthritis. So that
right.
happens and affects usually kids in the younger groups. And most of the times it's family related. And sometimes as well, you can get infections that have been there, like maybe septic arthritis. If a kid was playing soccer and then they fell, and then especially around with kids with septic arthritis, it likes the big joints like your knees. So like, let's say there was a cut and then you didn't see it, the kids continued playing, and a few days later the knee is swollen, I mean, like the kid can't move and it's hot. That's a big characteristic as well with juvenile arthritis, is that when you touch it, it's like burning hot, but the rest of the body, the child is fine. So most of the times is that there's like dirt that has gone into that joint and has caused an infection inside that joint. So then you've got a septic arthritis. But the most common is your osteoarthritis and rheumatoid arthritis, which rheumatoid is mainly those that the body attacking itself. That's the best word, and then causes the inflammation.
Okay, so let's talk about arthritis with advancing age. Is that to do with the decalcification of the bones, osteoporosis setting in?
So
Is that
yeah,
why we get arthritis? Or are we talking two totally different
yeah.
conditions?
So when we're talking about decalcification, it's like the content of the bone. So remember, you've got the bone in itself. So this is the content. So calcification affects how strong is this right now.
Ah,
Yet
right.
arthritis says, okay, there's a lining that's at the end here. That lining is ending.
Ah,
Adjoining this bone, that lining that is supposed to be moving nicely is not going to move nicely. So already, if you've got this bone that's quite brittle, is not strong enough, and you don't have this lining at all, like now you've got almost two problems. If you were to break this, if you were to be broken, then you've got difficulties in healing because this bone is not strong enough in terms of calcification. And also, even when you heal, that joint is not so nicely moving because of the pain and the less of the cartilage that's there.
okay, sounds very Aina.
It is.
But be that as it may, what is, what is the best advice? Because obviously you a medical advisor at Proactive Health Solutions, and we are talking World Arthritis Day. I was told way back when I had my babies, that very especially women, after having had their children, should up there, and now I'm talking calcification here, calcium supplements, and we're talking about porous bones or building up the bones.
Mhm.
But it does have a link to, as you've explained, the arthritis, because if you don't have strong enough bones, it's
Correct.
going to eventually impact on arthritis if it presents at some point or the other. So coming back to the issue of calcium supplementation, would you agree that once women have had babies, they should up their intake of calcium supplementation?
So, yeah, the supplements talk is always a contentious one because in medicine you replace what is missing. So you'll get different schools of thought in terms of
Yes.
like, especially just maybe a clear example. If you've seen these Vita drips, these yellow drips that people like, like skin is glowing, I'm feeling energetic, you know.
Yes.
That's why I'm saying it's a very contentious issue in the sense that what we practice as practitioners is that do no harm firstly and you replace what's missing. So many people, you'll find that like they are having problems with calcium, and I would say if you've got a calcium deficiency problem, you take your supplements. But most of the times you find that even in your diet, the yogurt that you have in the morning, the milk that you're having, those are sufficient, and things have been put in place. It's especially even just like with the foods that we have, like some foods have to be fortified, for it to be able to pass as a certain food. I mean, those are the things that the Department of Health looks at. So I would say that if you already, your doctor had said be on supplements, then just stick to that. But most of the times, the woman and the need of more calcium in terms of like as an extrinsic factor is when you are hitting your ages like around 40 and above, when you start having your DEXA scans, and also when you start going for your mammograms, that age when like your estrogen levels are dropping because of your age.
Okay, so on the same thought process, women taking calcium supplements, is there something at that point in time that they can supplement with, very especially if they have a history of arthritis in their families, and would feel that perhaps I got that defective gene from my mom or my dad. Let me kind of build myself up so that if I take a certain supplement, or if I follow a certain diet, or if I adapt my lifestyle in a certain way, I won't be I won't get arthritis, or I won't get it as badly as my mom, for
Yeah.
example.
So currently, Julie, I'm not aware of any research that has got certain supplements that will decrease your chances of having arthritis. However, we spoke about lifestyle choices. So one of the big things is that, being overweight is another cause, because remember, all that we have, if you are a times three my size currently, then you still have the same skeletal system to support all of
Ah,
that. So therefore, it is heavy for that. But then the moment you shed more weight, then your bones can move a bit nicer. But now, if I were to take all of these things and pile them up here for these bones that still need to move, then there's a whole lot going on. So, like I would advise the weight loss definitely, especially if you know that there's a history of arthritis. And also because remember, we spoke about rheumatoid arthritis, which usually runs in the family, going for regular checkups and just checking where you're sitting. Because if you think about it, we said it's the lining that's the problem. So if whatever you're taking, yes, it's going to help strengthen your with the calcium, it's going to help strengthen your bones. But the problem is that small lining and the joint that's there. And as I said, there's
the
not
cartilage.
research. Yes, the cartilage and also just that synovial joint. There's not
Yes.
research that I'm aware of that can help replace that, because then people would make so much money, whichever company would come up with such an
Well,
innovative.
there's a
Yeah.
gap in the market. Tell your company to go that route. Um, all right. So, having said that, signs and symptoms of arthritis, and do you find it's more prevalent in women or in men? And if so,
Mhm.
why?
Yeah. So one of the things also is that arthritis is quite prevalent, as you just rightly said, in women, because also you must remember with that whole, as we're growing older, the whole estrogen levels that's linked to that.
Ah, okay.
But another thing that I wanted to mention is that I spoke about juvenile arthritis, but there are different types of arthritis as well, like your gout, which is an arthritis that's quite common in men, and specifically in men that are overindulging, be it in your alcohol or also red meat. And it will specifically affect maybe the big toe of the foot. Or some people can even have gout in the ears, like you get people
Oh,
having almost like, it looks like lumps that they have in their ears, but it's gout that's like literally that you're seeing over that in their ears. Also, increased uric acid levels in the blood can cause gout. So when it comes to the symptoms, it's mainly characterized by a stiffness. So as we spoke earlier on, when you're speaking about your mother-in-law, and may her soul rest in peace, how she would describe the pain. Most of the times it's characterized that like there's a heavy pain, like I can't move my joints. At times as well, you will see that your wrist is swollen a little bit, and it might be also a bit red. And when you touch it, sometimes it might be a bit hot. And the biggest characteristic is that they can't move it, this decreased range of movement, in the sense that if you're able to move it like this nicely, maybe then the movement is just a little bit
okay.
diminished. So those are the
I can
characteristics.
move. I can move it very, very, very flexible. Thank God.
So those are the characteristics that you pick up in arthritis. Another thing as well that I need to say is that it won't just be also in the joints. Like even you can get it like on the ankles, then people like just say they have difficulty walking. But also you
Ah,
can get what we call osteoarthritis in the spine backbone. So people are constantly complaining about backache. I can't sit up, I can't do that. But when you do x-rays, then you see that, that joint cartilage is gone and literally bone is sitting upon bone. That is literally what we call
can I come in there? Can I come in there in a situation like that? Osteoarthritis in the back. Is there any treatment available for that condition? Um, and does that also then suggest that that person who constantly complains about backache? I know a few people that do
Mhm.
that all the time. What do you think has gone wrong in their lives
Okay.
that they've come to
So
this point?
true. So the backache is one of those almost like headaches, like literally there are doctors that specialize just in headaches.
Yes.
It's a very vast topic. So with backaches, most of the times it's caused by ergonomic factors. So how you're sitting. Ideally, all of us should be sitting upright, but we tend to slouch. And you're comfortable, you don't have problems with it. But it later catches up with you, especially people that are office bound and do sedentary work where they'll be sitting and typing the whole day. It's very important to support your lumbar spine. So like your spine almost looks concave like that. So supported by getting something, they even have those things that you can put on the chair to make sure that like you're sitting upright. That is the biggest one cause of backache most of the times. Sometimes as well can be related to muscles, but when it comes to bones and that, joints being gone, most of the time specialists like the orthopedic surgeons would say, okay, let's try medication. So you get what we call your non-steroidals. These will be your Brufens. These would be your Advils. So that's just to turn and try and take away the pain. But if it doesn't get better with the pain, surgery is the last option. But with
Oh,
surgery, having said that, any surgery that happens, it will never restore it back to its original place, especially when it comes to arthritis and bones. Because you might see that some other people end up getting what we call fusions. So with the fusion, remember I talked about this joint system. With the fusion, they will cut here and they will cut here and literally put these bones together like that to make it one bone that will not be able to move anymore.
okay. We have run out of time, but I do need to ask you this final question. I've also heard of lots of women going for hip replacement surgeries. What is that telling us? Is it arthritis problems?
So it's got to do with the thing that you mentioned about calcium and calcification.
Right.
Yes,
Okay.
that's where it's good to do it. And if you check, most of those women are women that are above the age of 60, like usually old ladies that maybe probably she was going to the bathroom, she fell and literally she breaks her hip.
Oh,
So those are the biggest reasons. And also because of that whole joint process that we talked about, it happens in the wrists, it happens in the shoulders, it also happens in the hip bones, where literally you've got this is your leg and this is your hip bone, where that is becoming a problem. And every time you walk, it's rubbing bone upon bone.
ooh.
Yeah.
It was such a pleasure talking with you this morning. I've
You're welcome.
learned
I'm
so
so
much.
sorry.
It was absolutely delightful. What do you want to share with us before we wrap up
Yeah.
regarding World Arthritis Day?
Definitely. So I think, one of the biggest things, we do this work because we want to inform. So I'm glad that your listeners right now have a bit more knowledge about arthritis than they did earlier on. But I think the biggest thing is just let's be sensitive when they're complaining of pain. Yes, you're going to be like, no, but mama, move. It is painful. So let's just be a bit considerate. And if they ask you to rub them, just rub them. It does alleviate the pain a bit.
Okay, Dr. Siviwe Mila, thank you so very much for being with us on the show this morning. You are medical advisor at Proactive Health Solutions, talking obviously about World Arthritis Day. God bless. Thank you indeed.
Thank you
And
so much, Julie. God bless
it
too.
was lovely
Bye.
having you on the show. Bye bye.
Thank you.
It is exactly 8 after 10 o'clock. Before I do wrap up, let me tell you what's coming up on the show tonight with my colleague Inayat Wadi from 7 to 8 o'clock. He's going to be looking at the water crisis in South Africa. Inayat, if you are listening in, all I can say to you is good on you and not a moment too soon. He's also going to be talking with Paul Hendler, and that is the issue around Israel agenda in Africa. A bit of background on Paul. He was born in the year 1951, grew up in South Africa. He was interpolated as a white Jewish male in an apartheid society. He wrote about ideological struggles against the hegemony of Zionism, as well as neoliberal housing and urban policies in South Africa. So that's a very interesting one. In fact, the entire show sounds very interesting indeed. A not to be missed show with Inayat Wadi. Thank you for being with me on the show this morning. Please take care on the roads, because our roads were a disaster this morning. So, let's not be idiotic on the roads. Let common sense prevail. Think of the opposite party, inshallah. Think safety as you drive on the roads, not only safety about yourself, but the opposite party as well. Thank you to our production team. That's you, Nasri Naidu and Golani. Time for me to wrap up. I'll be with you on Monday morning. Next up, inshallah, Juz 15 by Yasser Al Dosari, and Khuda Hafiz from me, Julie Ali.